Good morning. Welcome to Arundel County's third series on Facebook Live, 3 of 5 Facebook Live series on the discussion of the opioid and heroin crisis in the county and across the state. Today we're here with Chris Pedersen, the Director of Evolve Life Centers in Pasadena, and Kurt Hasbert, Addictions Medicine Nurse Practitioner with Baltimore Washington Medical Center. Thank you both for coming this morning and joining us. We're going to begin this morning with asking Chris, as the director, it's a huge responsibility, working with many young people in recovery and working with them in the continuum of care. But Chris, take us back, tell us a little bit about your journey, where your journey began in this world of recovery, and your place now at Evolve Life Centers.
All right, that's a loaded question. So, I mean, pretty much in order to speak on my journey into recovery and the director, I have to go back and speak of how I got into recovery, which unfortunately was using. And I don't have a lot of people's typical theory of addictions, or what it used to be anyway. I guess the stigma's breaking a little bit, but you know, back in the day, the stigma on people addicted to certain drugs were homeless people, or people in the city, or people in low-income areas, or people that weren't raised right. That was a lot of people's answer, was they need better parenting. But my story is, I had the greatest parents in the world, parents who taught me morals and values. I had all the potential in the world, or so the teachers told my parents when I would get in trouble, that I had all the potential and just wasn't applying myself. And I had a future. I was athletic, I was smart, or am smart, I guess, and you know, I had all these things in front of me and was supposed to go on specific routes that everybody had laid out for me, and I even believed it myself. But somewhere along the line, the plan switched in my mind, and it actually all started. My first drug, the first time I ever used, was the friends of mine after baseball games snuck a beer, and we all ran over to the dugout, and our parents were all hanging out after the game, and we all drank a beer. And I remember from that point my friends stumbling around, and I don't know if they were acting or not, but I remember standing there, and the only feeling that I had was, that's it, you know, that's all that's to this. And that was actually my experience with a lot of firsts. Every first time I used, it was, that's all. But for some reason after that, I just kept going, and I maintained for a while. I kept my grades up. I got to the private school of my dreams, and hated it when I got there. I don't know what it was. I had started, you know, smoking pot and drinking occasionally, and then what kind of deviated with me, but some friends of mine died, and I just became, actually 5 in one car accident, and I just became like real sad. But I had already started using, so it's the way that I coped with a lot of things, and painkillers came into play. At that point, like I said, I was athletic. I was also into rollerblading, skateboarding, snowboarding, things like that. And what comes with that is broken bones. And what comes with broken bones is, if you have problem A, then solution B was or is to prescribe narcotic painkillers. And I remember being 10 and seeing my brother, who had a surgery, being all loopy, and everybody laughing and joking and talking about how he was forgetting things, and because he was on painkillers. And for some reason, even at a very young age, I just kind of wanted that. I didn't even know what it was that I wanted, but I wanted that. And then again, after I took those, I wasn't loopy, I wasn't all crazy, I didn't get the same effects as my brother, so I took a little more. And that's kind of where it started. The first time I experienced withdrawal was in 10th grade, and I was on crutches still after another broken leg, and maybe I was just really clumsy, but 3 times I broke my right foot, and I was on crutches, and I remember sweating and feeling like I had flu-like symptoms and not really knowing what it was. And since I didn't know what it was easier to get through. But later on in life, again, as my path started to deviate, even though I said I know right from wrong, I just always kept choosing wrong and trying to maintain the appearance of doing right. It's progressive. It's progressive, and it kept going with just smoking pot and doing some of these things. But then the painkillers, a lot of friends were getting addicted to it, and I didn't get physically addicted again until I was probably 20 or so, after high school. And then it was just kind of a dark path. Because of all the broken bones, I was able to manipulate doctors and go on pain management for years and I was prescribed a lot of narcotics. Too much, if you ask me. The last doctor I went to actually told me that, so you've been prescribed these narcotics for years for a broken bone that happened 9 years ago that they put screws in a plate in and fixed. And I said, yes, with the fear that automatically set in that he wasn't going to prescribe me my painkillers, but he said he could not ethically stop me from my prescription, so it gave the addict in me a sense of relief that I was going to get my prescription, and it just kept going from there. I tried a lot. I tried a lot to stop, to kind of qualify myself for the recovery field that I work in now. I've tried multiple maintenance programs. I've tried for a very short period of time. In 2010, I tried the 12-step community. I think I went for like 15 days or something, but it was just easier for me to get back on maintenance. And it wasn't until I was kicked out of the maintenance programs that my disease, as you would say, progressed into heroin, which is something I swore I would never do. Like I said, I was raised right. I'm not one of those guys from the city that doesn't have parents. I knew that was wrong. I knew it was wrong. I said no a lot of times, but the way the brain works is the more you're around something, your brain becomes desensitized. The way it was best put to me was, if you move into a bad neighborhood, the first time you hear a gunshot, you run and hide for hours. After that, you might hide for an hour. And then eventually, the more you're around something, the easier it becomes. And at one time in my life, that was absurd to even think about doing heroin. And after doing heroin a certain way for a while, actually probably about a year, maybe two, I did the one thing that there's always, well, I'm not that bad, and to me, using a needle was not in the cards for me ever. Even if you asked me the morning of the afternoon that I used the needle for the first time, if you would have asked me that morning, I would have told you we're crazy and nuts and there's no way I'll be that guy, and I'm gonna stop tomorrow. I always had a plan for tomorrow. Tomorrow was the day I was gonna quit for 10 years. And it just, like I said, it's progressive. And the more you're around something, the easier of a thought it is. And you see that people are doing it this way, you're spending this much money, and it just finally, my own thinking broke me down to a point where I was willing to do that. And within a very short period of time after that, my mom found some paraphernalia, and she had to lean on the experience of some other people that had been through that, and realized that she was enabling me. And as much as she loved me, she had to love me enough to let me go. And she had to ask me to leave her house. And then that's when there was no more denying my reality. It had become what it had become, and I was living in a Motel 6 in Elkton, Maryland, by myself. The kid that had the bright future, all the plans in the world, all the potential, all the dreams, hopes, and aspirations. The kid that had all these things was now in Motel 6, just like those people he swore he would never become. And the main deciding factor in me wanting to get clean and seek treatment was, I have a son. And as much as I love my son, I couldn't fully be there. I had him physically, but I wasn't there mentally. And now I wasn't allowed to see him. And now all the, like I said, all the false appearances that I was holding it together, and all these things, they were gone, and everybody knew, and I was exposed, and I needed a better way of life. And this pain and all, like, people say the drugs stopped working, and I would still get high, don't get me wrong, but usually drugs numb you, And for me to be using the hardest drugs out there and crying and hating myself and wanting to stop and not wanting to die because I never want to hurt anybody, but not wanting to exist or wishing that I never existed, that's not me. That's not who I was. That's not who I am today. I love life. I'm a generally happy person. 90% of the time, people ask me, how do you always have a smile on your face? I love life, and I love my family. And to see the pain that they were going through, it just so happened that all the cards aligned for me. And I realize now that the help had always been there. I just didn't realize it. And this specific time, I was beaten enough where I was willing to do something different. And what I like to call it, and a lot of people I know like to call it, is the gift of desperation, where you're desperate enough to try a new way of life. You're desperate enough to try anything. And when you've tried it all, anything that's been suggested to you before, and you're just not ready at those points, at this time, it was nothing short of an act of God. And that's the only way I can explain it. Somebody showed up at that Motel 6, and they had just gotten out of treatment, and yeah, they came right back to the Motel 6, but they told me how to get into treatment, or how they got into treatment. They gave me their experience of how they got into treatment. And I said, I try to give every excuse in the book. I don't have insurance. Doesn't matter. They'll get it for you. Go to the health department. Talk to the health department. Talk to the people there. They have teams that will work with you, and they'll help you. So I went to the Cecil County Health Department, and they helped me. They got me on a list. And unfortunately, I think I was 107th on their list. So I had to wait, and in that waiting period is a dangerous time, because now, for me, I was able to tell everybody, okay, I'm going to treatment. I'm going to be okay. But really what that does is, in that waiting period, that interim period, is now it's almost okay for you to be using, right? And in your mind anyway, in my mind, it was okay for me to be using, and let's get it in, let's say, let's do as much as possible. But I was so scared of the drug I was doing at the same time. I would try to be safe. There's no real safe way to do it, trust me. It's like Russian roulette, but I was very scared of dying. And in that meantime, another friend that's in recovery that had moved down to Anne Arundel County, he came and saw me as well in the motel. He had called my house to check up on me and talked to my mom, and she said, he's in a motel somewhere. So they came and found me, him and his new girlfriend. And he just gave me hope. He gave me hope that you've already signed up for treatment. Now, why don't you come down to Anne Arundel County? And what I didn't realize, what I was walking into, is this is one of the largest recovery communities in the world. Between the 12-step communities, the recovery, Anne Arundel, everything. It's one of the largest in the world. I had no clue. I was just taking suggestions. But all the cards aligned for me to come to a place of, between all the pain and everything that I had been through, helped build up to this point of freedom. And I went to the treatment center that the state and county and everything graciously paid for, and they got me health insurance to help with that. And then I came to a recovery house that they suggested down in this area in Anne Arundel County, and got involved in recovery. And for me, it's been nothing short of amazing. I stayed in that recovery house for 14 months while, again, I said I had a son. So I felt like I had to be on an accelerated path to recovery. And there's no real accelerated path, it was just my feeling. But what it did was it made me dive deep. It made me dive and dig deep and start out in this process. And I didn't realize that I was becoming a vision of hope for the people in the recovery house. I was just doing it because I didn't want to ever do what the guy in the treatment center suggested for me to do, that if I ever decided to use, to look my son in the face and tell him that I was choosing drugs over him. I never wanted to do that. And I didn't realize that that's what I had been doing. And so I got involved. 14 months I stayed in that recovery house until Evolve Life Centers opened up. Sarah Burden, the owner, asked me to be the house manager. And I was kind of sketched out at first, because that's a lot of responsibility to be a house manager. And I was looking for an apartment to have less responsibilities and less accountability. And instead now I was in charge of holding a whole group of men accountable and have a job and keep plugged in with my recovery and keep moving forward. But what that led to...
We're looking, Julia House is asking, so you started with alcohol and marijuana,
Yes.
say we'll say high school,
Yes.
and today you are, she'd like to understand the time span from high
Okay,
school to
okay,
now.
yeah.
So like, basically, how old are you?
Right now I'm 31. I think the first time I ever experienced painkillers was when I was 13 and maybe 12 for the first broken bone. But the first time that I say that I used was about 12 or 13 when I drank that beer. And then it took a while. It took a while, but it's progressive and it got worse. So I think it took about 9 years from the first time I drank through the smoking marijuana to heroin. You know, it gradually got worse.
So, okay, yeah, let me jump over to Kurt. Kurt, at Baltimore Washington Medical Center, someone that's overdosed, and 911's been called. Paramedics transport a patient with overdose to the emergency room. Once the patient gets to the emergency room, what is the entry of treatment for that individual?
So initially, when a person comes into the ED, our main responsibility is making sure that their airway is secured, that they're breathing, and that their heart's beating fine. Because naloxone has a shorter half-life than most opiates, which means that it can wear off and a person can kind of re-overdose on the drug again. The other thing that happens oftentimes is that the person who is given the naloxone is immediately put into what we call precipitated withdrawal. So they went from a feeling of euphoria or feeling high to feeling very sick, as Chris described, nausea, vomiting, body aches, things like that, which are very hard to withstand. So the initial reaction for a lot of people that have overdosed is to leave the ED so that they can use again, so that they won't feel that way. So what we've done in cooperation with the health department in Anne Arundel County, we had a grant that we received from the Substance Abuse and Mental Health Administration to start what we called the Opiate Overdose Survivor Outreach Services. We started at BWMC in January of 2016. It's been expanded to Anne Arundel Medical Center in May of 2017. And what that does is put a peer support specialist, kind of a guy like Chris, who's been there, who's experienced the ups and downs of addiction, who's found recovery, and they go to the bedside and they talk to the person and say, this is my story, this is what happened to me, where are you in this realm of change? If the person is ready for change, we talk about the various forms of treatment and we try to use a patient-centered approach so that we match what the patient wants to do and what's available to them. We have a nurse that would then come in to do a medical assessment, gather medical records, and then make arrangements to put a person either into abstinence-based treatment or medication-assisted treatment. We try to do the medication-assisted treatment within 2 days because we know, as Chris said, if you don't get treatment, you're going to start using again, and then the risk of overdose is higher. We also have a Safe Stations program in Anne Arundel County that's separate from the hospital, but it's a very worthwhile community endeavor because if you have a problem and you go to a fire station or a police station and tell them, I need help with my addiction, they will start the process of, first of all, a medical evaluation. The medics will do a basic vital signs, how you feeling thing. And then they will activate the Anne Arundel County Crisis Response System to come out and work with people to get them into treatment.
So, Kurt, what is addiction medicine?
So addiction medicine is the practice of helping people, mind, body, and spirit, to overcome their problems with drugs and alcohol. We know that addiction is a neurobiologic disease. Chris really hit the nail on the head, that it's really a disease of messed up circuitry in the brain. Some people can take a medicine like Percocet or an oxycodone, and they feel maybe a little pain relief. They might feel a little nausea. And so those are the people that don't have that part of the brain that's very susceptible. But some people, as Chris described, when they get the feeling that a drug like oxycodone or other opiates produce, it's very positively reinforcing, and they want to do it again. And unfortunately, the more you do an opiate, the more your tolerance builds up. And tolerance is the need for more substance to achieve the result that you got the first time. So we know that people may start out with 5 milligrams, and then they need 10, and then they need 15 and 20. And then what happens, as Chris talked about, you start having withdrawal. And withdrawal is a very painful experience. And unfortunately for people that suffer from addiction, one of the ways to alleviate the symptoms is to use more drugs.
Well, let me ask you this. Does the medical community define addiction a disease?
Yes. We know that the research is getting better. There's always the nurture versus nature argument, that we know that environmental effects of how you grow up, what area you grow up in, if you've been marginalized as a child, trauma histories, all play into it. But we do know, again, that there is a neurobiologic basis for addiction, and it's in the brain, in the deep limbic system of the brain, that certain people genetically are predisposed. If they're exposed to the substance, oftentimes, just like other diseases, it's a chronic thing, it's relapsing. We know that people have periods of remission from addiction, and unfortunately people have times of relapse, but that's not unlike any other disease that we treat, such as hypertension, diabetes.
I'd like to read, Sherry Mitchell is asking, with her statement, every addict I've known has started out with alcohol and marijuana, yet with the push for legalizing marijuana, this is being de-emphasized, with many now denying that pot is a gateway drug. Can we speak on this? I can offer this, that yes, everywhere we go, all the people that I've met that are in recovery tell me that when they go back, started with alcohol and marijuana, progressive, just like what Chris described. And yes, medical marijuana is coming our way here in the state of Maryland and Anne Arundel County. It is a state matter. I don't want to push back on the state, but for those of you that are on the side that it is a gateway, I would highly recommend that you contact your state representatives and let them know that you oppose anything more than medical marijuana, because that is coming. The next step is recreational marijuana, and there's a lot of applicants across the state hoping to open up, start their cultivation businesses, dispensaries, etc. So I would encourage you to contact your state representatives. Let's talk about sober living, Chris. Describe to us actually what takes place. What is the structure within sober living? How long does someone usually stay at a residential property for this part of their care?
Well, with sober living, if it's done right or by the guidelines. So nationally, we have NAR, which puts out a set of guidelines for sober living so that it's done somewhat properly, and then state picks up their guidelines, and we have MSAR now, MCOR, and they kind of put out some guidelines for housing. But the structure that comes to place is, well, the reason for sober living is one of my good friends who's a counselor and also one of our house managers has used this theory. When you take a tree that's in a polluted swamp, and he shared this many times with me, when you take it in a polluted swamp and the tree's dying, and just as if they're an addict and they're stuck out in the street using, and you take this tree out of the swamp, of the polluted swamp, and we bring it into treatment and we nurse it back to health, and everybody's there caring for it, and you have doctors and nurses and everything nursing this tree back to health, and then to take it out of that treatment and put it right back in that same polluted swamp, it's going to die again. It's going to become polluted again. It's the atmosphere that you're going to, the people, places, and things you always hear. So the reason for sober living is to get you into an atmosphere of recovery and people that are trying to do the same thing as you, people that have been through the same thing as you, a peer-based system of care, people that have been where you are, just like the peers you were talking about, and have gotten out of it and have gotten involved in recovery And because just like for me, I'm the average of the 5 people I hang out with the most. So if I go right back to my normal family or to a polluted swamp, I'm going to digress. So the structure is you have a house manager, and unfortunately, especially when we're first starting out, we need to be held accountable. We need to be held accountable for our actions. We don't know how to live. We don't really know how to think much. If we did, then we probably wouldn't have wound up where we wound up. So the accountability comes into play with house managers, assistant managers, RAs, a staff overseeing drug testing, curfews, chores. You have to get involved in recovery through a 12-step fellowship, and you have to be engaged in that recovery, because there's a lot of people that are trying to that are scared for their life, and they don't want to die. So if you want to be involved, you have to get involved in recovery and keep going with that process. And it's just little things: keeping your room clean and learning how to live, signing in and out of the house, so that every action you make, you realize that you have to be held accountable to at some point, and actually think about your actions before you do them. That's the point for us, is to hold you accountable until your thinking has changed. Our managers were trained through Dick Prody at Shepherd Pratt, and he says that, to move out, there's no time length. It's just when your thinking has changed.
Great. I want to go back to Aaron and Sherry are both bringing up the topic of pill-pushing physicians. The opioids are easily prescribed by doctors. I would just want to say, not my child, when we do the panel discussion, we really emphasize everyone being their own advocate. When you go to the doctors and a doctor wants to prescribe a medication, you really have to ask a lot of questions. We have to be our own advocate. Yes, we trust our doctors, but we have to ask questions. So with that, I want to ask Kurt, at Baltimore Washington Medical Center, is the medical staff have programs in place where they bring the doctors together to educate the doctors on the opioids? Is there something happening at Baltimore Washington?
Well, we don't necessarily have a formal program to educate physicians. That's one of my roles as the addiction medicine nurse practitioner, is to collaborate with physicians and nurse practitioners, physicians' assistants, on correct prescribing of opiates. We also at the hospital have a pain management nurse practitioner who I work very closely with, so that we can safely prescribe medications. One of the issues that has led to this opiate epidemic is the fact that several years ago, about 20 years ago, there was a big push by the American Pain Society to eliminate all pain. And we know that people with chronic pain cannot have their pain completely eliminated. The goal of pain management is to make a person quality of life better while they still have to live with some pain. And unfortunately, there was some marketing by some of the pharmaceutical companies that suggested that opiates were very safe. So people started prescribing them in very high quantities. And unfortunately, it sounds like this is what happened with Chris. He was one of those people that had the susceptible brain. So when his brain got that opiate, it said, yeah, give me some more. My doctor prescribed this to me. It's got to be safe. And then he took them to the extreme, and he started developing withdrawal symptoms. And that led him down a very terrible path. And that is a path I see over and over again with a lot of the patients that I see, is that they started off with an innocent prescription. They got their teeth pulled, they broke their arm, something like that happened. They got pain medication, and their brain said, thank you. And the brain said, thank you, and give me 2 more. And unfortunately, that's one of the reasons that we are facing this epidemic as we speak.
Earlier, Chris, Vicki wrote, tell us about your 4th step. What does Vicki mean by the 4th step?
I think it was Vic, and
Vic.
I know him personally. He was probably just saying I was going into depth about my using story. So that's one of the things that you do through the step process, is you kind of dig deep, find out your patterns, find out all about yourself, because you don't really know yourself. That's what he meant.
Okay. So, how long have you been with Evolve Life Centers?
I've been with Evolve since the day it opened.
Which, how long have they?
September 15th, 2015. And the day it opened, I moved in. There were only 2 of us. Only 2 of us. Now there's about to be 100 beds throughout Anne Arundel County.
Oh, wonderful, wonderful. So, have you networked with other providers that are in the sober living community?
Oh yeah. Oh yeah. So last year we went to the NAR conference just to kind of see what's going on at a national level and meet people that are doing it all across the country, see how it's going. And not to mention, I mean, I came through a recovery house, so you know, at certain houses, and Mickey in the Opportunity Ministry, she won an award last year. I was able to be there. I was there for 14 months. So she has a huge spot in my heart. I'd do anything to help her. So we've worked together. They call me when they have questions, which is amazing and kind of blows me away, and I call them if I need anything. And it's, you know, that's the point of this, is we need to work more together, actually. We need a network of sober living to communicate, find out what's going on. I've sent emails out when we're finding abuse of prescriptions that you never thought would be abused, you know, and it's a new trend. So we have to communicate with each other to stay on top of this and to stay one step ahead.
Great. Kurt, let's see, I saw Sherry Brown. Yeah, about Vivitrol. There's no methadone, Suboxone, and now Vivitrol.
Okay,
Can you
so
talk about those 3?
there are 3 major forms of medication-assisted treatment. You mentioned methadone. Suboxone is another option, and then the third option is a medication called naltrexone, and they work differently. The naltrexone actually doesn't have any positive effects on the receptor in your brain called the mu receptor, but what it does is very strongly block that receptor. Now, naloxone is the long-acting form of the medication that we give for overdose, which is naloxone. This is naltrexone, I'm sorry. Naltrexone is the long-acting form of naloxone. Now, we also have a longer-acting form called Vivitrol, which actually is an injection that lasts anywhere from 25 to 30 days in the system. And so essentially what you've done when you give a person a shot of Vivitrol is block their opiate receptors in their brain that could cause them to have euphoria. So using would be ineffective. You would basically be just throwing your money down the toilet. So it is a viable option for those that don't want to be on any medication that has positive effects on the brain. One of the downfalls with Vivitrol is because it doesn't have that positive action on the opiate receptor, we see a lot of people that have a lot of anxiety and a lot of depression that are on Vivitrol. So it's imperative that someone be in some form of treatment and or 12-step participation while they're on that and being closely monitored by a clinician.
Great. Chris, are you familiar with Opportunity Ministries?
Yes, I was there for 14 months.
Oh, well, why don't you tell us about their work?
It's amazing. So, Opportunity Ministries is one of the reasons why I'm here. They are the ones that I had the bed with when I first got down here. And through county participation and everything, I've received some funding and was able to have some time, because that's important. You know, most of us come here with nothing. I came here with nothing. All I came to this area with, to Anne Arundel County, was I had a suitcase when I got down here, but before that, everything was in Glade scented trash bags. I had a pair of Under Armour slides, burn hole shorts, and old shirts, because everything I had before that was work clothes. So I came down, was able to get the funding through the state, through the county, and gave me some time to find a job. I didn't have a cell phone. I didn't really need a cell phone. They scared me. But I don't know, the most important, I wasn't there much, to be honest. I was working nonstop, going to a meeting, eating, coming home. And anybody that lived with me knows that I was barely there, just to sleep. But then we had our house meetings every Friday. And they're so important to sit down with the people you're living with, and a lot of people cook meals together and grow that like family bond, because a family is just, you know, we're family, you know, and we had these house meetings where we grew together and we got to really know each other, and then we get to see each other grow, and that's the truth. That's where you get your hope. That's where you get your strength from, other people growing, and you want that. So So you do it. And if I could, just real quick, talking about the marijuana or Suboxone or methadone or all these touchy subjects that are going on. The thing is all of it, every bit of it can work if you work it. I don't necessarily agree with a lot of practices that happen because people can abuse it, and what it comes down to is, education for the doctors, like you were talking about before, because they're learning a lot. And like I said earlier, when you have symptom A, solution goes with symptom A. And they've been taught all this time that painkillers go with this, but had no clue what was going to come of it. But the marijuana, I've seen it work for people that need it. I've seen it work. I've seen people that break a bone, my mother, and needs painkillers and doesn't come out on heroin. It's something within us. And also, Suboxone and methadone. I can honestly say that I did not work a solid Suboxone or methadone program. I abused it. A lot of people do. The Johns Hopkins study, 2/3 seem to be abusing it. But the thing is with abstinence-based recovery is nobody can misprescribe abstinence. Nobody can make money off of abstinence. Nobody can overdose off of abstinence. And that's what kind of led me in that direction. But as far as, people, all the gateway and everything, Vivitrol's great, and, it all can help people if done right.
Yeah.
It truly
So
can.
I think one of the things to mention is that there, as in any other disease, there's a spectrum of what works for certain people and what doesn't work for certain people. Some people are satisfied with being on a methadone program and not going into stores to shoplift and not breaking into cars and maybe getting back to school and things like that, and that may be okay for them. Other people want what Chris has, which is a total abstinence-based 12-step recovery. So as a clinician, I have to look at the scientific evidence that's out there. We do know that medication-assisted treatments are superior to abstinence-based programs within the first year of recovery. Also, we know that even though you are on a medication-assisted treatment, support groups such as AA and NA, there's another very vital support group called Smart Recovery out there, assists people in staying clean. And again, what Chris said is working a program means different things for different people, and we have to keep that in mind.
Great. Let's talk about the family impact, because Chris, you said your mom she put you out. She took that tough love approach. What can you say to encourage other families in this struggle that haven't taken that step, that they're continuing to enable?
Well, the first step to any problem is admitting you have a problem. And whether that's your problem or a family member or a loved one's problem, denial can be a huge killer. And if you're not facing it because you don't want your friends and family to know that you have an addict in your family, or your child has become addicted to heroin or painkillers or whatever it could be, really, alcohol, if they're sitting in their room drinking all night every day, and all that is deadly. And that's the first step is just, it's okay. It's okay. It happens to everybody. It happens to more people than you know. It happens to a lot of, I'm sure half of your friends have some sort of addictions running through their family, and they're just not talking about it. That's what breaking the stigma is. That's what saying it's okay. You have to address it, but you also can't enable them. And not addressing it is enabling them, allowing them to stay in the basement or upstairs and just do what they're doing and turning a blind eye. And if you're feared up about kicking them out, right? Like my mom's probably watching, and she hates when I refer to her as kicking me out, because she had to. And I thank you, Mom, if you are watching. That was the thing that led me to my point of desperation. But the thing you have to realize is if you're scared you're going to kick your child out, or your nephew out, or your grandson out, or whatever it may be, your sister, brother, you're kicking them out, they may go overdose and die. That's your number one fear. I understand that fear is real, but the truth is allowing them to stay could allow them to overdose and die in your bathroom. So if my mother didn't kick me out, I could have very well overdosed in her bathroom and they would have never found me. We didn't know about naloxone and all those things then. It wasn't as available. We've made great strides in that. Please, if if you are going to allow a using addict to stay in your house, go get certified in the Narcan. They have them everywhere. They'll come to you. You can come to one of our houses and get it there. They do them for free. You can get your prescription and get educated on how to use it. I just had a good friend move into my house yesterday. Because he was in an IOP at a health department, they automatically naloxone trained him. He happened to go home and tell his mother how it worked, even though he was never going to use again. He just, look how cool this is. I got trained in this. This is how it works. A week and a half, 2 weeks later, he overdoses in the bathroom. She knows where it is, knows how to use it. It can truly save lives. Education's key, but accepting that this is what's going on, and it's painful and it's hard. It's gonna hurt, but sometimes you have to ask others for help. There's support groups, Nar-Anon. I just heard about another one, Families Anonymous, Al-Anon. Great support groups. Great support groups. Come out to Not My Child. There's amazing mothers there that have experienced loss and all these things, and there's help out there for you too. Please, please, please allow them to get help.
Nancy, can I just clarify some things about the naloxone training? There are trainings throughout the county. Baltimore Washington Medical Center offers 3 trainings per month. But in Maryland, as of June 1st, you do not need the training in order to obtain naloxone at a pharmacy. We strongly encourage that you do come and get the training, because there's more in the overdose response training program than just how to administer naloxone. So we strongly encourage that, but you do not need to have the training in order to obtain naloxone. If you go to the pharmacy, speak to the pharmacist and say, I want to get a dose of naloxone, you can use your insurance. And if you have Maryland Medical Assistance, you get 2 kits, and the copay is only $1.
Great. Well, I want to go back to education. Chris, when you were in school, was the DARE program in place?
Yes, I remember.
Do you remember those classes?
Barely. I remember, Just Say No. I remember This Is Your Brain on Drugs, the fried egg. I remember.
Oh, you remember that?
Oh, yes. Oh, yeah, okay. I remember this. I remember the egg falling off and cracking. I remember the frying of it. I remember those things. I don't remember exactly what DARE taught. I remember friends talking about programs coming in and showing them, heroin addicts and what it does and all these scary things. And they were saying how disgusting it was. But half of them still wound up, using. But still, I remember those concepts.
Well, the state of Maryland now, through the governor's opioid intervention teams across the state, and here we have one here for our county as well, an OIT team, and our school system is part of that team. It's my understanding that coming down the pike is going to be more education, maybe down into 3rd grade. Let's talk about what do we think is appropriate for 3rd graders, elementary school children, through middle school, because the high school kids are telling us we're too late. When we go in and do Not My Child and do the student assembly, they say, go back to middle school. We should have heard this back in middle school. But there is a conversation, and I do believe it's coming down. There's going to be education as early as 3rd grade. How graphic can we be with young people today to impact them on the dangers of the drugs that are out there?
I can't really speak to that because I don't treat adolescents, and I know there are plenty of people that are working on our opiate intervention team that have that expertise. But what I would say is that unfortunately, a lot of the 3rd graders have already seen the impacts of this. They've seen a brother or sister, mother, father, grandfather overdose. A lot of unfortunate children that are in our school system have seen the chaos of addiction, the police coming every other night, mom, dad out for whenever. So they probably have already seen a lot of these effects. But I would really defer to the experts on that. But I do think that early prevention efforts are extremely important. And that's something, unfortunately, in our American medical system, we focus very little on prevention. We worry about when a person gets a disease to treat it. We don't necessarily do a whole lot to try to prevent those diseases. But I think things are changing.
Yeah, things are changing. So I would encourage the audience to connect with the Anne Arundel County Public Schools, because we are in Anne Arundel County, encourage them to take the steps to bring that prevention education into the elementary schools and through the middle school. Let them know that they have the community to support to do the prevention education and that is so needed. Let's see. There. Damian Clark's already said, my daughter is 5 and I have already had the discussion about drugs. Well, that's great, Damian. Through Not My Child, that's another conversation we have. Encouraging parents to have the conversation with their children at home. And so with that, let me do a shout out to our health department and our coalitions across the county that are doing great work. Please go to, for those parents looking for, what do I say to my child? Substanceabuse.org, preventsubstanceabuse.org is the website. You can get information on the county's coalitions, as well as they have tools for parents to start the conversation with their children. You know, what might be appropriate conversation over the dinner table. Chris Germain is asking about that Ocean City Convention. Can you tell us about that? Is that a big event for the recovery world?
It is. So there's multiple conventions, and without getting too specific, the Ocean City Convention, what it does for somebody like me is makes me realize. You spoke about the statistics and all that. Unfortunately, what it did for me, like, I've heard statistics and they're great and they're amazing, and don't get me wrong, I'm not trying to knock them, but unfortunately in an anonymous program and things like that, you don't realize how many of us are out there. You don't realize, you guys don't get to see the statistics that I get to see every single day, which are amazing, and people thriving and living and getting their kids back and doing all these things. But the Ocean City Convention, what it does for me is allow me to realize how many of us are out there. And when 10 to 12,000 people with the same common goal of recovery are all there in the same exact room, listening to the same exact message, all feeling the same exact thing, it connects you and makes you realize you're not alone. You weren't alone when you were out there, as alone as you felt, and you're certainly not alone now. It's an amazing feeling to realize how many people are out there. And when you go out at 6 a.m. to the grocery store and people are wearing their name badges that are getting ready to go to the convention, and you realize everybody in the store is just like you. Some of them have 20 years. It has the days that they have clean on their actual name badge, and some of them, I mean, it's thousands and thousands and thousands of days that they've been doing this completely, free from that old way of life, and it's powerful. It's amazing.
Let me ask a question. If someone out there wants to attend a meeting, because I've heard we have over 300 meetings happening across the county, how does someone get the information to know where a meeting is, who's sponsoring a meeting?
Well, that's, you can probably, I would assume that public relations from multiple fellowships have dropped off information and pamphlets at the health department, because, I mean, if all else fails, you can stop by my office. I have plenty of information. There's pamphlets, there's meeting slips everywhere. You can go on websites, you can kind of Google it. But the health department has those resources, and I'm not sure of the exact websites, but it's something along the lines of na.org or aa.org, and they'll have meeting lists and schedules, and you'll see how many there really are around us.
Another thing, Chris mentioned it on the websites, but if you call the intergroup office and ask where a meeting is, oftentimes they're gonna try to convince you to have someone in the fellowship come and escort you to the first meeting, because it's very tough to walk down those steps for the first time. So having another person who can kind of guide you into the rooms, show you around a little bit, and destigmatize the basement of churches, I think it's a really good thing.
Great. Is there anything else that we need to put out through this session? Anything else you'd like to offer?
Well, if you're out there struggling, just know you can do it. Know that there's so much help. Know that there's so many people you don't even know that are rooting for you. I like to throw that in there, because you have no clue how many people are committed to helping you that don't even know you.
So is Glenn?
That's my father.
That's your dad.
Yeah,
Hey, Dad.
Hey, Dad. How are you?
So
Could I also say that You know, unfortunately, in the medical community, when people come into the hospital that have problems with addiction, there are some places that do it really well, and unfortunately, I've heard stories of places that don't do it very well. I think we're trying very hard from the addiction medicine and addiction psychiatry side of the world to try to improve things like that. A lot of hospitals now have consultation services where someone that's specifically trained in addiction will come and visit you while you're in the hospital. So that is something that I would encourage people that maybe if they've not had the greatest experience in the past, to open up a little bit when you get into the hospital and ask for a professional to come see you.
So Linda Jean, what is being addressed regarding a situation when you have an addict ready to get help, needs detox immediately, and the hospitals makes them their last priority, and there isn't an immediate option for detox, and everyone has to wait? If you have an addict and they are coming for help, they need it that moment, not 24 or 72 hours more or later. Yes, I have heard this before, that we have gaps in service. Is that being addressed?
So one of the reasons why there is a problem like that is because of the federal regulations around prescribing medications for detox. If you are a prescriber, a nurse practitioner, a physician, you have to have a special waiver on your DEA license in order to prescribe Suboxone, which is one of the major drugs that we use to try to ameliorate withdrawal symptoms. So first of all, there's lack of volume of doctors. The other thing is that it takes several hours, maybe even up to 8 or 10 hours, in order to properly initiate someone on a detox program. And unfortunately, emergency rooms are not equipped to handle that type of patient. In the emergency room, our goal is to evaluate a person, to treat them effectively, to set up a legitimate aftercare plan, and then to discharge the patient, because we have patients waiting. And if anybody's ever been to an emergency room, you know that you don't really feel like sitting in the waiting room for 6-8 hours. And that is another one of the reasons that we're trying to dispense patients to things like the crisis response folks who can assist us in obtaining resources that maybe we as a ED do not have. They have relationships with providers all over the county that they can access, and they can actually take the patient that's been discharged and keep them in one of their crisis beds for the amount of time. Now, is that the best situation? No, but it's really kind of the best things that we are doing. We understand that this is a problem, and we're actively trying to work on it.
Someone here is asking about dual diagnosis. How often does that patient present with an underlying mental health issue? It's
statistically speaking, it's about 40% of the time. In my experience, it's a lot more than that. One of the questions that came up that I was reading as I was scrolling down is that a lot of times people are addicts before they take the first drug, and that's usually related to an underlying mood disorder. Their mood disorder leads them to seek relief. When they find the drug or the alcohol, that's the relief that they find, and unfortunately, sometimes they take that to excess. So dual diagnosis or co-occurring disorders are very common. One of the things we're trying to do in treatment is to be able to integrate services so that no matter what you have, whether you have a high blood pressure situation, a depression, or a substance use disorder, when you come to the doctor or the nurse practitioner, we'll take care of everything. At Baltimore Washington Medical Center, in our community health clinics, we've actually placed therapists and a psychiatrist right in the offices so that a person can get that help that they need in one stop.
I just want to circle back a little bit to the top. First of all, the importance for getting somebody into treatment fast is, there's nothing more important to me at that point. But just so you know, Anne Arundel County specifically has made unbelievable strides, gotten extra funding, and does so much to get you the help you need fast. The safe stations at any fire station, if you don't know, we've talked about it, but You can go there and ask for help. Jen Corbin and the whole crisis team, they're amazing. They come out, they talk to you, they'll help you. I've brought at least 5 people there myself, and I see them get into treatment. And it's not just the state facilities. You don't know which facility they could help get you into. Yes, there might not be a bed. Like I said, I was 107th on the waiting list. I went back 2 days later and told them I didn't want to leave. I would die if I left. And they help you. So when you're showing willingness and you're up front, but going to those safe stations, there's a girl commenting on here that actually we brought to the safe station that's saying, thanks for helping save my life. Like, this thing works. They help you almost immediately. They may not be able to help you that moment. The beds might be full, and that's just the world we live in. But they will continue to help you. They follow up with you. They'll get you into the treatment you need. And Anne Arundel County has a lot of beds available. And if they don't, they'll try to get you somewhere else. There's a lot of help out there, more than you guys realize. If you know where to go. If you don't, you don't. But now the safe stations are amazing, and the police are on board, and they're working. If you're scared about your warrants, don't be. They're working with people that have warrants, and they're working with people on probation and drug court and all that stuff, so that you don't have to go back to jail and you're getting the treatment you're seeking.
Right. Let me give the number if we have anyone in the audience that needs a call out for help for someone they love that's ready for treatment, or for themselves. They need help in determining their own coping skills. Talk to counselors. You can easily call the crisis response number at 410-768-5522. That's the crisis line, and they will send out clinicians to talk to the family and or that person that needs treatment to start the treatment process.
I just want to say congratulations to Fawn. She wrote in and said that she went to a fire station and got help, and she's 40 days clean. Congratulations.
Congratulations.
Another one I called for treatment on Friday and was in treatment by Tuesday. So it's there.
I just think we should encourage everyone to try to remain positive. Yes, there's a lot of work to be done, but we're being very proactive. There's been huge networking. I think that's what's been so really cool about this. All of the different county government agencies, our nonprofits, are really working closely together to be there for our citizens that need help. So I'd like to bring this to a close. Well, with what, I have 3 more minutes?
Yeah.
I have 3 more minutes. So Chris, do you have any interest in being a panelist for us here in the near future for Not My Child?
Ooh, I accidentally got tricked into doing it once,
Yes,
but
you did.
I loved it. Look, this is my passion. This is my calling, helping people. And I couldn't see my life turning out any other way, or going through the life that I went through, knowing the pain that I've been in, knowing there's another way of life and not giving back. And there's a lot that happens in the 12-step communities and the recovery community, but there's a lot that needs to happen to break the stigma and truly get people to help and break the public's perception on addiction. And it's my passion. I couldn't imagine doing this any other way, so of course I would love to. It would be an honor.
Right.
It truly would.
Linda Jean is writing about, sounds like she tried to get someone help and then had a lot of obstacles. I don't know. I called every number on the internet I could find to know. Well, then Linda Jean, call me. Call Nancy Schramm at 410-222-1527. Let's have a conversation. Let's talk about what happened, and let's see how we can help you. So please do that, Linda. So I think we are about ready to close out. I want to encourage everyone to visit the county website,
aacounty.org.
aacounty.org/heroin will take you right to the Not My Child page. Check out the calendar of events. We're going to be across the county between now and November 30th with our conversation. Please come out and join us and bring people. We need to fill the seats. We need to educate and reduce the stigma. I want to encourage everyone to join us again next Tuesday, August 29th. County Executive Shue And our Director of Health, our Health Officer, Fran Phillips, will be with us 9 o'clock for our next episode on Facebook Live. Thank you and have a wonderful day.